UFC is one of the most notorious sports for insane injuries, especially for a doctor in the sports medicine field. Now, with the upcoming Poirier versus McGregor fight, I wanted to do an overview of the 5 worst UFC injuries to date. Let's get started. For those who don't know me, my name is Sonam, and I'm a resident doctor specializing in sports and exercise medicine. I create videos about injuries that athletes sustain in sports, so if you want to stay up to date with the latest content, please subscribe down below. For now, let's get back to reviewing some gruesome UFC injuries. One of the most iconic ears in UFC history is Leslie Smith's cauliflower ear. Let's take a look at the injury and kind of go over why a cauliflower ear is such a pain in the butt. And oh my God. Absolute insanity. Just take a look at this one more time. If we go back, we'll go slow-mo. And unfortunately, she gets her cauliflower ear completely busted. You can see the spurt right there. All right, so what is a cauliflower ear? Essentially, it's pretty much known as a boxer's ear. And essentially, your ear is made out of the skin and cartilage in between that sandwich the skin. So that's that floppy stuff in between. And when you play combat sports quite a lot, you can get actually blood that builds up between the layer of the skin and the cartilage. And with that blood will form something called a hematoma, solidify, and then create this cauliflower-like appearance. Now, unfortunately, in Leslie Smith's case, she was developing a cauliflower ear during play, played through it like the insane UFC fighter she is, and, well, let's just say her opponent drained her ear for her. Usually that's something I'd be doing on the sidelines, because if we have a cauliflower ear with a big hematoma or a blood collection, we can actually cause injury to the structures underneath due to lack of blood flow to the area of the cartilage. So it is something you want to drain in most athletes. Okay, so let's take a look at Matt Mitrione. Unfortunately, he had a few really bad gashes to the eye by his opponent, and he ended up with an insane hematoma over his eyelid. So we'll take a look here, and look at that. Like, when I saw that, I could not believe the size of that blood collection. I have yet to see something this big in clinic. If we look a bit further, it sounds like the reports say that he actually suffered both a pre-orbital hematoma as well as an orbital rim fracture. I wanted to quickly show you this on my anatomy specimen. So this is basically the skull, skin taken off. He had a hematoma in this area here, which is kind of that upper eyelid area. But when he went to the hospital, he was actually found to have a fracture of his orbital rim. So it's this bone up here. It's part of your frontal bone, but that's the orbital rim right here. So fracture in anywhere along the orbital rim can actually cause entrapment of your eye muscles and can lead to either permanent eye damage or even vision loss. So if I take off this bone here, and we'll just remove that brain there for you, the eye is in a finite space. And there's a series of muscles that make your eye go left, right, up, down, and diagonally. Now, in a fracture, such as an orbital rim fracture, these bones can actually entrap some of these muscles. So it's actually one of the ones you need to get them to an ophthalmologist and actually repair these. Now, the other issue with his giant hematoma on his eye, so if we go back to his video here, the giant hematoma on his eye is that in some cases, that hematoma can actually develop inside the eye socket. So if we looked at the eye socket again, the eye socket is a finite space. If you have a blood collection draining into that area, a finite space with fluid going into it can cause something called a compartment syndrome. Squeezes all the actual structures in the area and can lead to compression of your optic nerve, which causes permanent blindness. So in his case, he didn't have that, but it's something to consider, especially as a doctor on the sidelines. One of the most iconic injuries in UFC is Anderson Silva's broken tib fib. Compound fracture as he was kicking, completely bends on screen. Let's take a look. And that is it. Like, look at that. That actually wraps around his opponent's leg. You don't often see fractures like this in slow motion unless they're either recorded by spectators or, for example, recorded in professional sports. And the sad part is he doesn't even know that he's got a fracture until he tries to step back on it. Now, I mean, this is a brutal fracture. We don't have actual x-rays of his, but I kind of wanted to show you what a type of fracture this is. So if we look here, essentially this is the tibia, which is the big shin bone. This is the fibula, which is the one on the side. It's the one we don't really care about. And he fractured straight through both of them. So we call that a compound fracture, a fracture of more than one bone. Didn't look open in the actual footage, which means that the skin would actually be showing bone. Seemed like it was just a break. The skin was intact. Now, the surgeon who treated him said that he only needed to actually fix the tibia. So it looks something like this, as an example. Usually they only actually fix the middle or the big shin bone because the one on the side, the fibula, is not weight bearing. So as long as you fix the tibia or the shin bone, which is your load bearing bone right here, this little guy, your fibula, will heal just fine. In many cases of isolated fibula fractures of this little guy, we don't normally treat them. They tend to find each other, they tend to heal quite nicely, and athletes can kind of continue progressing their sports as tolerated. Next injury we're going to look at is Alistair Overeem's insane lip gash. I've seen a lot of lip lacerations in my career, but I have to say this is one of the worst. All right, so check that out. That is insane. You can actually see the top of his lip completely tear open. And as you can see, he's got a pretty impressive lip gash. Now, is this life-threatening? No. Is it cosmetically appealing? Heck no. Do UFC fighters care? Probably not. The interesting thing about this, though, is ideally, when he got punched in the face, his lip got caught, likely over the mouth guard, and with the shearing force of the punch, completely gashed open. Now, he split his entire lip all the way up to kind of just lower than his nose. Now, the one thing to consider when you're repairing some of these is they actually may need to see plastic surgery in this case, because most emerge docs, when you have a full thickness lip gash, you actually may need to use multiple sutures. Some of them will do it, some will request a facial surgeon or a plastic surgeon to do this. And usually you're gonna have to do multiple layers of suture. And the most important thing when it comes to healing lip gashes is you actually need to make sure that this little area, which is called the vermilion border, is approximated well. Because if you don't, you'll have a little lip line that looks off kilter. Women will care because their lipstick wouldn't look good on it. Do I think he's gonna really care about it? Ideally not. I have seen some post-injury scars, and honestly, he healed pretty well from them. Alrighty, and then we have Joeeph Pyfer and his dislocated elbow. So take a look here. And it's essentially the way he catches himself. The elbow completely goes out of whack. So I'll show you back in slow motion. And right here, as he's being essentially taken down, puts his arm out to brace his fall, and the elbow essentially completely comes out of the socket. So you're seeing this front part kind of move forward and the back part go backwards. And you just see this arm completely flop. And honestly, when I saw that footage, I thought he broke his arm prior to them releasing it was just a dislocation. In most cases, elbow fractures or elbow dislocations aren't as severe as elbow fractures. In many cases, you can actually pop it back in, much like a shoulder, isolate them and restrict them in a certain range of motion by splinting them in flexion and letting them follow up with orthopedic surgery. Now, there are some cases where they can be surgical, and that's if there's bone fragments in the area and if it's a complex elbow dislocation. So usually with an elbow dislocation, they actually rip their MCL and their LCL ligament. So you have your LCL ligament here and your MCL ligament here, much like in your knee. And when you dislocate an elbow, those tend to go with it. And the sixth one, I know I said 5, but the sixth one is too funny not to include. And that is Johnny Walker's worm shoulder dislocation. So there is something to be said about maybe celebrating too much. And if you take a look here, Johnny Walker gets the knockout, bam, left shoulder pops out right there. And he's just in complete agony. And it's super embarrassing winning your UFC fight, trying to do the worm and popping out your shoulder. I have actually had this happen while I was covering an event. Hockey player celebrating, went to pop up his arms, bring them back down, shoulder completely popped out. Quite embarrassing. We put it back in the actual change room, but it happens. And he could have very well had an injury that predisposed his shoulder to being a little bit more unstable than not. But I found that pretty funny. I found that pretty hilarious. It's pretty much bread and butter. We can pop it back usually kind of off the court, off the rink, off the octagon usually. And in some cases they may have to go to emerge, but in most cases, and he's good to go. And that wraps up our whirlwind of gruesome UFC injuries. Now, if you want to see any of these injuries covered in more detail, leave a comment down below. If there was a UFC injury I missed, pop it down below and I'll do my best to get to it. Now, if you like this video, please click on the like button. If you want to see more videos in the future where I break down injuries that athletes face so that an average fan can better understand them, please subscribe to my channel. For now, that's all.